Let me pull up the webinar. So, okay, thanks everybody for joining us today. This webinar is titled Native Americans with Disabilities Empowered Through Self-Advocacy. My name is Austin Moore. I'm a member of the Samish Indian Nation, and I'm an attorney for the Native American Disability Law Center in the Flagstaff office. With us today, first I'm filling in for Annette Yazzie. She is an advocate with the Disability Law Center. She's the usual one that runs these, but I'm filling in for her today. Next, I'm pleased to introduce Kathleen De La Rosa, sorry. I have her bio here too. Let me pull that up. Okay, so today with us we have Kathleen De La Rosa. She's the Community Action Coordinator with Assista Independence, which is located in Tuba City, Arizona. Assistance to Independence provides appropriate services such as peer mentoring, information, referral, advocacy, and independent living skills to enhance the quality of independent living in a culturally appropriate manner. As the Community Action Coordinator, Kathleen's duties are teaching the AZEEI curriculum to new consumers, covering disability history, independent movement, Arizona Independent Living Network, advocacy, communication, leadership styles, and community involvement. She also works as a consultant to the peer mentors who have started a coalition group. She'll provide information about the organization's services for people with disability and answer questions like, what is independent living, how to promote self-advocacy, and taking control of your life. So again, this webinar is called Native Americans with Disabilities Empowered Through Self-Advocacy. This is part 4 of the 9-session series designed to help Native Americans with disabilities understand their rights and develop self-advocacy skills to access needed services that enable them to live in their communities. This free series is open to people with disabilities, their families, and other supports, and no registration is required. So, okay, now I have a few guidelines for the webinar. So if you don't mind to introduce yourself, if you could provide your name or program, agency, and tribal affiliation in the chat, as well as if you are an individual with a disability, or if you're a parent, advocate, self-advocate, professional, or other. And so I think this says comments and questions will be addressed throughout the webinar. However, we will have a question and answer session at the end of the webinar. So if you want to place your questions in the chat as we go along, that's fine, but we'll address them at the end. And then again, this webinar will be recorded and posted on the NADLC website. I can provide a link in the chat to that. And then webinar surveys are used to improve outreach and dissemination services. So lastly from me, a quick introduction to the Native American Disability Law Center. We provide advocacy, referral information, educational resources to all Native Americans with disabilities living in the Four Corners region. We monitor facilities on the Navajo Nation to ensure persons with disabilities are provided with the services they need in the least restrictive environment. We provide legal advocacy and representation in disability-related discrimination. And we also provide advocacy and legal representation to Native American students with disabilities and education-related issues. So now let me hand it over to Kathy. There you go.
Hello, I hope you can hear me. My name is Kathleen De La Rosa, and I'm of the Navajo tribe. My clans are is a clan in Shlo Tatnesani Bashichin, Twidijini Dashachego, Ado, my Dishkijne Dashanel, Ado, Baget Bahot Zanado, Yisinasha, Ado, Ikut de eya Tuba City de eya ad e nashnish. Ado e with eya assist to independence with nashnish. That's the hot nachi. My name is Kathleen De La Rosa. My clans are Tangle, Mini Goats, Tangle, Bull, Bitter Water, and Coyote's Path. I'm originally from Piña, and I worked in Tuba City at Assist to Independence and the Community Action Coordinator. And I've been working with Assist for almost going on 4 years. This fall, it'll be going on 4 years. And I absolutely love, I absolutely love my job. And this is our part of the mission statement: empowering American Indians with disabilities to live in harmony by creating opportunities to live independently. So I'm also a person with, at Assist to Independence, one of the qualifications is they want to hire somebody, people that have some sort of a disability. And my disability is I have a vision difficulty, and I'm not blind, but I'm also can't see well enough to drive, and so and then I also have a condition called albinism, so which means that I have blonde hair, blue eyes, and fair skin, and I burn easy. So and I'm a person that that cannot blend in with the natives. You can see me out there. So, okay, so that's me. So I have this albinism website where I'm also a contact person for the southwestern part of the United States, or in Arizona, and I can give out information about them and everything. So this is, I guess I can say, is this is part of my people. Native American is my people, and the albinism community is also, I feel like they are part of my people too. So, okay, next slide. Okay, at Assist to Independence, this is our building. We are located on the east side of the hospital in Tuba City, and our numbers are down at the bottom. And and then our contact information. The first one is the office number, and then the second number is to our receptionist, and the third number is my work cell number. And we also, Assist also has a website, and that's listed there, www.assist.org. And there's a website for that also. You can check that out. And our program serves the Navajo, Hopi, and Southern Paiute nations. And but anyone that is in the northern part of Arizona can come in and request services, and they're more than welcome to do so. So we're like in the pocket, kind of like in the back pocket of the hospital. So when you come to, when we had now we don't have our office open. We haven't opened it back up yet, but we still work here, and then part-time, and the rest of the time we work from home also. So we do all our online work that needs to be done here, because some of us, we don't, the internet service is kind of bad. So we come in here to work and then go home the other 4 hours. So, but you can reach us anytime by phone and all that. So, okay, next page. Okay, what is independent living? Independent living means that people with disability, they want to have the same choices and they want to have control of their lives the same way that their people that are non-disabled friends, their neighbors and family, they take it for granted. This includes taking risk and taking responsibility and having the same right to succeed or fail. You know, that's the only way that you know, you can fail so many times, but you keep going and going, and you know, sooner, you know, you'll succeed. And that's what we teach our participants. It used to be we used to call them consumers, but now that's politically incorrect. I guess now they're participants. So this is where the Assist to Independence and then me, that's the AZEEI staff, make it we make it our job to teach them, you know, that the participants how to do this to live independently. Okay, next page. Okay, what are we about? ATI is an acronym for Assist to Independence, and the service that we provide is they call it information and referral, and that's where a person can come in and or call and, you know, ask questions, you know, what is this about, or, you know, I need help. And the receptionist will, you know, fill out a form for you, and they call it an INR form, and you know, depending on what you need, some people just want to come in and you know, ask questions about what services that can be provided. And one of the things is life skills training, advocacy, peer mentoring, and transition for youth and people that are in the nursing home. They want to come back and live at home. And then we also have durable medical equipment, and then transportation services. This is a whole lot. After they do the INR, they are referred to another staff. We have a staff where they take care of each of these skills or these trainings, and then the peer mentoring, like the information and referral, is taken by our receptionist or our data entry clerk, or whoever answers the phone, and then they're often referred to the ILC, which is Independent Living Coordinator, and they start working with them depending on what they need. They start providing services for that, and then they work with them there, and then they're referred. After that, they're referred to me, which is as the Community Action Coordinator, CAC. That's my acronym title, and I teach them about the AZEEI and where they learn advocacy, and the peer mentoring is also part of they start calling in for that, and then the ILC also does the transition, where youth transition is where if they're still the students are still in school and they're ready to go on to a higher education, they want to do that. So they help them, and then sometimes they have what was that place called? Another oh my gosh, I can't believe I forgot that place. Anyway, they go hand in hand, and then they help this student. They apply to several places, and then they pay for their school, and then our program can help the student move to that to their location of school if it's in the valley or somewhere within driving distance. And then if there is a person that's in the nursing home that doesn't feel that they should be in the nursing home, that want to live at their own house or their own home or in their own community, they can apply to, and they can bring them home and set them up where they get home care providers. Now they have those, and set them up with that, and sent referrals to all these other places, like long-term care and all that, and with different organizations work with them, and then get them home so they can be among their families and be there with them. And because we hear a lot of you hear a lot of stories about nursing home, and they get depression is one of them that that gets to them. And so taking care of your own elders, that's one thing. And then also one of the other services is durable medical equipment. We have Assist has some like wheelchairs or walkers, portable commodes and stuff like that. They can either loan them out, or depending on how many there is, and I think that's up to the receptionist is the one that takes care of that. She logs it in, and then they make she has an inventory of what's available. And then we also take if people want to release their equipment, because after if they're not in use anymore, if it's still good, we take those and reuse it, clean it and everything, and reuse it. And then there's also transportation services, that's another thing that we do. We have several vehicles that have drivers, and just call and then see where you need to go, and all that is for the elders and for people with disability. In order to qualify for these services, you have to be an elder, or have some type of a disability that is visible, or you can have a doctor's note, because some of those things are being when forms are being filled out, that's where it's documented. And all these information that is taken, it doesn't stay in the office, it goes into we call it sales suite. That's where it's online, where we input all the documents and information on there, where it's behind almost sort of like a lock and key, and you have to have a password to log in and access those records. So they're safe like that. Okay. AZEEI stands for Arizona Education and Empowerment Initiative. I'm the one who teaches that class. When they're referred to, when they get their INR information and referral, and then they get work with the ILC Independent Living Coordinator, and then they refer them to me, and then I call them, and then I set up classes with them. In those classes, they learn how to, in this class is called, it's Independent Living Engagement Curriculum. It's a project of Arizona Independent Living Network. It offers, I teach about the disability history and the independent living movement. You know, it doesn't start just like 50 in the 70s. It goes way back, you know, way back when it started, and we have videos that they can watch, and you know, and then the Navajo Nation, we realize that, you know, is so far behind on you know, the civil rights. They just barely passed it, and here it was passing in the 60s with the federal government. But still, even though, you know, it's been passed, the services are not, you know, rendered, and they're not abide by, like, just barely within a couple of less than 10 years ago, they're finally beginning to make ramps and all that. And, you know, with these federal buildings and all this, they have to have access, and, you know, disability parking and all those, you know, we learn about all that, and it's amazing how, you know, much things change, and it goes all the way across people with the school, and elders, and people with, you know, with all types of disabilities. Advocate and learn how to advocate for themselves after they learn how, you know, the history and the independent living movement, you know, how it started and all that. And then Arizona Independent Living Network, there's Assist is one of them. There's five centers that that we're part of. You know, Assist is a partner with them, and our partners are, let's see, here it is. Ability 360, they're located in Maricopa County. They have a huge facility over there. And then Direct Center for Independence is located in Pima County. And then New Horizons is Disability Empowerment Center, and they serve Mojave and Yavapai counties. SMILE, Services Maximizing Independent Living and Empowerment. They do Yuma County. And Assist to Independence, Navajo, Hopi, San Juan, Southern Paiute reservations. See, we cover the whole part of northern Arizona, you know, the reservations, and we're still kind of small. We're still in the local areas, but we're branching out, you know, going as far as we have participants from Window Rock, and then from White Ruins, Ganado, you know, up that way, and then Tuba City area, and then Kaibito, and then Tonalea, in that area. So in this class, they also learn advocacy, learn how to advocate, and leadership and communication skills. You know, learning how to, you know, ask for things and without getting angry and throwing a fit. There's ways of doing it. You know, you got to be calm, and actually be calm, and then still be persistent. After learning about this, then they tie it all together, and then the community engagement is the last one, and that's where they learn how to implement the advocacy. So usually our group, the coalition group, some members, they want to refresh, and sometimes, you know, I usually go over it with them individually if that's what they want to do. And so, you know, to do a refresher course or something. So that is my job. And then after that, you know, the peer mentor still goes on. The peer mentor still goes on. And then they developed a coalition group with this one too. The peer mentors. So, okay, next page. All right, here's a flow chart of what I was telling you about, you know, to make it more easier to understand, I guess. The first contact is requesting services. So you call in and then you say, I need this and that, and, you know, maybe I want a transportation. My disability is this, you know, and then it goes down either to transportation, and then we have a transportation coordinator, and what their independent living needs are, and they usually want to do medical appointments, and then they set up, you know, like a lot of them, some of the ones that they transport daily is dialysis appointment. And then COVID-19 vaccine and booster shots. If they want to, anybody can, you know, if they need that, they can be transported there. You know, they just need to call, and then they can be transported to get their vaccination and booster shot. And then people with disability want to run some errands around town, that can also be, you know, scheduled for them. And then another one that goes to the right, to the left, is the ILC, Independent Living Coordinator. And usually it should come with an INR, but if not, then she, you know, that they fill out the INR, and then they document it into the sales suite. So they have a file in there. And then they start coming down, and then they start doing the training, and then what they need, and peer mentoring, and transition services, advocacy, and or INR services. Sometimes they need like renovation, like one of the things that they do is schedule ramps, you know, build a ramp and something like that. And during the pandemic, one of the things that they did was, you know, taking portable hand washing stations, and, you know, and then they learn how to build those too. So, and then after that, while they're doing that, they're referred to me. The participants are referred to me, and I take him through classes. Used to be, before the pandemic, they used to come to the center, and we used to have classes here. But because of the center closing, and because of the pandemic, everything is done over the phone. So I have a freeconferencecall.com set up where I can teach them over the phone. And then we have our meetings, the peer mentor meetings and the coalition meetings over the phone. And so far it's working out pretty good for us. And it taught my two participants to speak out, and, you know, instead of, and voice their needs, and that they grew in that way, you know, learning to advocate for themselves. They actually have to speak now, because they can't just, before, I guess they were shy, and they just said, oh yeah, hi, you know, when they came to the meetings, and just, you know, listen in. But this time, if they want to be heard, they speak up, and they do speak up. Okay, next page. Okay, some of the activities that went on before the pandemic. this was, you know, this was so much fun. I think one of the things that we had was a cooking class that they had started, and the food were, you know, bought, and they did chopping vegetables, and they did all the prep work, and some, you know, we had somebody cooking and stuff like that. And that they did that as a group, part of the IL training. And after they, you know, do the prep work, they got to eat their own salad. So, and then they also went to trainings. One of the trainings that we went to was a sister center at Ability 360 conference in Phoenix. So we transported these three gentlemen over there, and they went with us, and so it was I think it was like a 2-night trip where I think they said they were going to the Capitol, and then but we didn't go to that last one because we didn't have any contact with the representatives yet. So, and then another thing was that we didn't know, we weren't familiar with the legislations that were going up and what they were voting on. We didn't familiarize ourselves with that, so we didn't go to that one. But the trip was good, and there they got to sit in on all these meetings, you know, the coalition meetings that they had there. They got to listen in on it, and which kind of sparked their interest. And so that was one of them. Another one that we had was a Braille instruction. So we have a Braille instructor that she volunteers. She herself is blind too. And then she's also a certified Braille teacher. So she, on her breaks, she volunteers, and then she has students, and the assist bought some Braille papers and stylus where the students can, you know, learn how to start, you know, doing stuff in Braille. So as a matter of fact, I just got off the phone with her about an hour ago. So she said school is over and she's ready to go back and teach. So I told her that we have some more students for her, so I need to enroll them, talk to them and enroll some of them. So she's excited about it, and we talked about some other things that we, you know, that she could do, and she's pretty excited about it. So I hope some of our Braille students are listening. So get ready, get all your papers back in order, and get ready to learn something, some bumps. And then, okay, another one was we had a Savvy, a presenter that came out from Yuma. This Savvy is, I don't remember what their name. Anyway, it was about a school for the blind. I think a vocational institute. I think vocational institute. That's the last two I know. Southern Arizona. I don't remember what the other one was. A vocational institute. Anyway, they had a. They came up to see if there was any people that were blind that needed to go, because they were told by vocational rehabilitation, that's the one that I was trying to remember, VR, that there isn't anybody that's blind up here. So they wanted to check for themselves, and when they came, we had a whole room of people that were, you know, not literally, but you know, a couple of gentlemen that were, you know, they're blind, that came to our peer mentoring meeting, I think they had, and they came and did their presentation here. It was, they had planned on maybe bringing up somebody to teach up here, but that never, it was in the process of in the planning stages and when the pandemic hit. So I don't know what happened with that. So we just have to check in on that again. But we have our Carol, our Braille teacher. She took off with that class, and so she's doing that. And then another one that they did was Nikisha walk by this group, Native American Disability Law Center, Huskies group. They invited Assist to do the walk, and so we took our group down to Window Rock, and we went from the gas station all the way to the Capitol. And before the council delegate had their sessions, we sat outside and they advocated right there, and there was a lot of speakers. Of course, there was another group that was there too, but we end up staying longer, which I think that was really good, because some people stayed around, and some of the delegates kept coming out and checking to see if we were still there, and we stayed probably up to noon, and then we went home. So that was a good trip for them, advocating and firsthand. So they got to experience that. Okay, next page. All right, and then here's another one. We had, when we had students that finished the class, they would get certificates. So we did a little graduation, and the certificates were presented. And then with this one, we did a peer mentoring. During the peer mentoring meeting with a lunch, that was their graduation reception. It was nice. We had 2 students that graduated. And then another thing that they used to do was parties. They used to do parties, let me see. With this one, was a Christmas party with a potluck. So every holidays, we would make a menu. One of the participant, he was working here also. He likes to cook a lot, so he got to practice on us. So he used to cook, and he write a menu, and we all sign up for what we're going to bring, and we bring in the participants, and then we have our meeting, and then they get bused home. So this was one of the highlights that happened here. It was never a dull moment in this building. Now it's really quiet. So, okay, next page. All right, so here it is. Again, this is my section. This AZEEI curriculum. After I teach that class, out of that, we have branches that comes off of it. The peer mentor and the coalition group was already, established. They were, the peer mentor was already, going, and the coalition group was beginning to get on their feet. So the peer mentor group, they're very active now, and when participants, when somebody is not having a good day or something, and they're feeling down, or they get stuck, or they're in a dilemma, they usually feel comfortable calling in when, during those meetings, and call in, and you can almost hear it in their voice that, something's not right. And the participants, pretty much know each other now, that they kind of jump on it, and, they talk, and usually the person tell the group what's going on with them and what their situation is and all that. and then pretty much everybody, put in their 2 cents or how they resolve the issues that they were talking about. So by the end of the meeting, pretty much everybody shares about how they handled their situation when they came across something like that in that same scenario. And I think these peer mentor meetings I think they're the best because they share a lot. I mean, they've really grown, and sometimes I think, this is what we're working for. This is what it is. We're working for this, and it sometimes, brings me, it rejuvenates me, and I think, yeah, this is where it's at. So, and then there's the coalition. They are the peer mentors decided that they needed to advocate, I guess, and they had some concerns, and then that they had faced, and they didn't do, and then they knew that their friends would be, going through the same thing, and they decided to form a coalition group and talk about it. And then they got a name. They named their group Northern Arizona Tribal Disability Coalition. That's what they named themselves. And the acronym is capital NA, and then small z, and then capital TDC. That's the acronym. And they named the group, and then they started holding the meetings, and then they were following the Robert Rules of Order. They started following that. Then they developed the bylaws, and right now they're becoming more active. And as they're becoming more active, they came across South Advocacy Solutions down in Phoenix. They became part of their group, and that group had a scholarship that they were advertising. So the group applied for the grant, and they actually, got the grant. And I'm so proud of them that everybody was putting in, when they were doing their mission statement, everybody was putting in, what the mission statement is going to be and all that. So it was something else to see. So and then they became the western part of the reservation, the focus group. And in Tuba City, that was the focus group for Native American Disability Law Center. So we got a call from Husky, and they're helping that in that way also. And so, and then after that, when they were doing that, and when the pandemic started, my concern was for them. I would think about, they're isolated, and we were told, everybody was told, stay home and social distance, and don't go anywhere. And this group was already isolated to begin with, and doing social distancing actually made them more isolated than ever before. So other people that were they were getting angry and crying about being isolated and social distancing, and they still drove around and this and that. But this group was like, it was hard. And their main thing of coming into the center and congregating with their friends, and this is where they came to hang out and to talk and to with the group was, you know, taken away from them because of the pandemic. So I started this good morning, call in and let's chat over coffee every Monday morning at 10. They would call in, and it was just talk. You know, there was no meeting minutes, nothing taken. Just, you know, talk about whatever you want, what you did over the weekend, and what you have plans and all that. We did this, and then we would have, like, for holidays, they would talk about what they did over the holidays, and you know what was up. They talk about music, movies, anything, you know, games. Talking about sports, and I'd have no idea how they, you know, keep up with all the sports. I don't even know how to, you know, begin to, you know, get in on that conversation. So I just listen. So, and then like over Christmas, we had several people that play musical instruments. They had Christmas caroling. I thought that was so cool. I got to hear them sing and all that. That was good. So, you know, stuff like that, they did that. And so to this day, they still call. Every Monday morning, you can call at 10 o'clock just to talk and listen and say hi and all that. Some of the consumers, they're gone for a while, and then they finally call in again, and everybody's like, where were you? You know, all this and that, everybody jump on each other. But, you know, it's all in good fun. They're so comfortable with each other. And I think because of this, the Good Morning and the peer mentoring and the coalition call-ins, they really learn how to speak and advocate for themselves, and they're ready. You know, they're not shy to speak out. And I noticed that when we have meetings, webinar meetings, and that we go, that, you know, I log in on others, I see them, I hear them, you know, they're asking questions and, you know, putting in their 2 cents on a certain issue and all that. So, you know, they're learning. I think that's a pretty good group. So, okay, next page. So, okay, this was some of the activities we did after the pandemic, during and after the pandemic. So what we did during the pandemic was we partner up with some groups like John Hopkins and Hearts to the Navajo. They got several church groups together, and they haul like 2, 3, I think 3 or 4 semi trucks full of essential supplies. They hauled them up to the Navajo reservation. One went to Peñon, the other one went to Chinle, and, you know, the remote areas, Horse Lake and all those, you know, they would call us, and we would go there and pick up supplies. And the supplies were essential stuff like Lysol, toilet tissue, paper towels, and dish soap, and, you know, sanitizer, wipes, all kinds of things, and masks, homemade masks. And at that time, you know, there was no masks to be found. Even on Amazon, there was those disposable masks were not even available. They were always sold out. So they collected, people were sewing masks, and then that's when, you know, where we picked these up. And in one of the pictures, that's where we were hauling a whole truckload, a whole flatbed load of supplies. And behind there is our executive director. She was hauling some essential supplies too from Holbrook. she picked it up and we followed each other home. And we had to have, and this is when they had curfew. And after a certain hour, you couldn't be out. So we all had to have a letter, essential letter, what do you call it? Letter from the executive director saying that we're essential workers and that we need to be out. So we were getting home. So, and then when we brought them back, our workers and bagged them up, and then they loaded up the bus, and then they drove around and dropped off all these essentials on this picture. And I didn't really take any pictures because right at that time I caught COVID, so I was not part of this. But I grabbed these off the Facebook, so these pictures. So you know how these stuff were hauled to the participants. And then let me see. And then the ones that wasn't pictured was John Hopkins. They donated they call it survival boxes. There was these huge boxes full of essentials, even food, non-perishables. And then they also had homemade hand washing stations. And they went with all these boxes. And so we delivered those also. So, and then our staff also went on a training in Flagstaff learning how to make a hand washing station using trash cans, and I don't remember how else they did it. I didn't see it. I just saw little clips and pieces of it. So I didn't go on that trip. So anyway, that was one of the things that happened. All right, next page. All right, this is one of the ones this is really cute. There's Bear's son. He was walking across America, remember, from California to New York. And he was walking for, collecting donation for people with disabilities. And one of our staff went out there to meet him. And I was like, make sure you wear your shirt. So she did. So she wore her Assist to Independence shirt and she represented us there. And I thought, throw this one in for fun. So, okay, next page. All right, so Assist has a Facebook page and the address is right here. I don't think you can click on it, but you can copy and paste, and put it on Chrome or Google. Google it and it'll take you to those. Like if you have, if you log into your Facebook, you can put it in there in the search area too. And it'll take you to that website and you can join the group. And then Northern Arizona Tribal Disability Coalition also has a Facebook page, a group page. So the Assist page, we had one for prior to this, and I don't know what happened. It crashed and it just disappeared, and we were asking each other what happened to it. So they had to start a new one. So we're just barely starting out again. So, and then this one, the coalition group page also barely started too. So come visit us and become our friends. So, that'd be really cool, hang out with us. We're a good, cool bunch of people. All right, I think that's it. I think that's the last page, I'm not sure, of my presentation. Yeah, oh, there's questions and answer period.
All right, so awesome. Thank you so much for that information, Kathy. It was good to learn about Assist. So for the question and answer period, feel free to post questions in the bottom, either on the chat or there's a Q&A section that you can also post them to. Two questions we had for you all in attendance though was, how is this presentation helpful to you? And then what other topics would you like us to present on? And then just real quick plug. We have a save the date. So the next session is going to be on Wednesday, June 29th. So that is the last Wednesday of June. And then here's the contact information for Annette. Annette is usually the person from the Law Center running these. So this is her contact information. I can put this page up later as well. And then here is Kathy's information as well.
Okay, one of the questions I see is what age range is it for? We have youth, the ones that are in school right now. We do like I said, we do the transition for them, and I'm not sure about the children. I think they get, you can come in for information, so you'll probably get referred to Growing and Beauty or Vogue Rehab or something like that, because the referrals are for them also. So, you know, we try to help everybody. And then elders is in one of them, yeah.
And if I recall, I think Valerie's question, I think she posted that when you were talking about the good morning call-in. Is there an age range for the call-in?
Oh, okay. The good morning call is for anybody. They we'll probably post the numbers on the coalition page. So, and then if you become a participant, if you get an INR, like information and referral, and you call in, and I usually take, they usually take attendance, and then your information gets, you know, documented in the sales suite, and you know, and that way it'll be easier for, you know, for the staff to serve you, you know, better, and if you get more information, because some of these meetings we have, like we have little webinars and stuff like that also. We do little presentations, like one of the coalition, we have people that come in and speak. We have special speakers that come, that get invited, and they actually do speak. So information wise. I'm sorry if I was boring.
I don't think you were.
I'm so used to having call-in meetings, and where people actually talk over each other, and you know, so I'm used to that kind of meeting. So this felt like I was talking to myself, but it's cool though. Okay, cool. So we have a new, they joined the Facebook, our Facebook page. We have, there's Assist to Independence, and then also the coalition page too. There's two of them that you can join them. So, and then whatever you have, whatever, like this one, the webinar series, we'll post them on our in those Assist to Independence and the coalition. I'm sure it'll get posted there too. And Elton, I seen his post up here. He is the president of the coalition group, the Northern Arizona Coalition Group Tribal Coalition. He's our president. So he's at every meeting. So it'll get posted. So, and then I do whatever information flyers I have that comes across, I also post it on my personal Facebook, because my personal Facebook is, you know, public. There's no privacy on. I mean, well, some information are private, but you know, anybody can see my page. So I specifically did that because I do post some webinars and stuff like that on there too.
Okay, I see Carol Green is raising a hand, so I'm gonna allow to talk, so then you should be able to
Okay.
be able to post your question, Carol. Okay, should be able to turn your microphone on.
Okay, I'm unmuted now.
Great, we can hear you.
I just wanted to say hi to everybody, and like Kathleen said, I'm all set to start Braille again for the summer. And I would also like to, I was telling Kathleen earlier today that before the summer is out, I would like to have us as a group put together a proposal that we could submit to the Holman Prize with this San Francisco Lighthouse for the Blind to support the coalition's objectives, which one of them is to have a facility for the blind and visually impaired. So, so I think that as a group, we could submit to the Holman Prize with the Lighthouse for the Blind in San Francisco. So you have to be blind or visually impaired to submit. And I think it'd be great if we could submit as a group. It's a $25,000 prize, but the Holman Prize requires a budget. But your actual project has to be more than $25,000. So they're only contributing for like part of your project. So I think it'd be great as a group if we could come up with some ideas on how we could start moving towards that for you guys to have. And then hopefully with the Holman Prize, there's also a lot of public recognition. So maybe we could get some additional outside funding and then see what type of funding the community, like the tribe, the different tribal agencies in the state can provide to begin a facility. So that's all I had to say.
Thank you, Carol.
Mm-hmm.
I guess we'll set up a meeting with the coalition or the peer mentors and Alton. If Alton is still on the line, he'll probably take a note of it.
Okay. I'm not seeing any more questions, but we can stay on for a little bit in case anybody has any last minute questions. I'll post the contact information again for everybody. But thank you everybody for joining us today. And then thank you very much, Kathy, for joining us today.
Yeah, I was so scared and actually it was fun.
Good, good.
Yeah, it's fun. I don't know if I like to hear my own voice, but
Yeah, I'm gonna stop the recording real quick.